Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case report of idiopathic pain. Okay, so patient had basically come with a chief complaint of pain in the lower left side region. So we took a CBCT scan of the lower left side. Okay, so basically the area of concern was 46, 47 and 48. So after looking at the scan, so we could observe there was an impacted third molar that was seen, okay, in close relation to the nerve canal, though it was not in contact with the nerve canal cortex, but it was in a very close relation to the nerve canal cortex. Okay, so we also wanted to rule out some other findings related to 46 and 47. So we just zoom in the area of concern 46 first. So this is tooth number 46. We'll just check the area of concern of 46. You could see there was an initial PDL widening noted, okay, in relation to 4-6. So we studied 4-6 from buccal aspect to the lingual aspect. So as we go from buccal aspect to the lingual aspect, we could observe some kind of radiolucent, fine linear radiolucent line in the sagittal cross section. So we just aligned that thing toward in all the cross sections, and we could observe the similar line that was seen in the coronal aspect. Okay, so this was the line that was noted in the sagittal section and in the coronal section. We studied this thing in smallest thickness 0.5 mm. We could clearly see some kind of fine lines in the coronal aspect as well. This could be suggestive of cracked tooth like syndrome, like there was a micro crack line that was noted over here, and that was extending from the dentinal surface to the pulp chamber. Okay, so this is the line that was noted. Okay, similar line was noted in the coronal section but not very well in the axial sections. Okay, so this could be one of the reason for the pain, as well as there were micro radiolucencies that were noted along on the mesial aspect of the tooth, which could be suggested of dentinal caries on the proximal aspect. Less likely it could also be an artifact, but the line was clearly well evident that was noted. Such lines are not usually visible in a RVG scan or a OPG, so always an CBCT is advisable for such cases. So this was one of the thing. And now coming to tooth of concern 47. So this was tooth of concern 47. Okay, so we'll just decrease the thickness to 0.5 mm and go from buccal aspect to from mesial aspect to the distal aspect. Okay, so this is the mesial aspect of the tooth. As we go towards the distal aspect, we could see one finding over here. Okay, so this was the radiolucency that was seen, which is suggestive of class 5 caries. We can see well evident radiolucency that was noted on the enamel and approaching the dentine, but not towards the pulp. We'll get the lines along the long axis of the tooth and towards the and see it in XYZ view. Okay, so this was suggestive of class 5 caries as noted in the 3D volume. Also, we could observe that thing. Okay, so all these things require treatment via simple filling, and for 4-6 root canal may be required, and this thing can be cured with the help of filling, composite filling. And now coming to the tooth of concern 3-8. Okay, so this is tooth of concern 3-8. As we can see, okay, this is horizontally impacted over here, but we could also see one more finding in 3-8 over here where the crown is present. Okay, so could see some kind of radiolucency over here. Now this thing, either it could be an artifact over the root of 4-7, or it could be suggestive of a micro crack line due to pressure that is caused by the adjacent impacted tooth over the adjacent normal tooth. Okay, so all these require clinical evaluation as well. Okay, so this is the region of interest as seen, one, and this micro crack line like appearance. Okay, so this was a case of idiopathic pain that was caused due to impacted idiopathic. The three reasons could be due to impacted tooth and cervical abrasion in cervical caries in 4-7, and cracked tooth, micro cracked tooth in 4-6. Okay, thank you so much.